Welcome back, future nurses, to our video lecture. And for this video lecture, we are going to continue discussing communicable diseases and infectious diseases. And let's go straight. So we are going to discuss pertussis or whooping cough based on references. And this one is this one is also a disease that is affecting the respiratory system, and it is characterized by repeated attacks of spasmodic coughing, which consists of a series of explosive expirations, and typically it ends with a long drawn um, inspiration, long drawn forced inspiration. So it also produces a crowing sound if you're familiar with the bird, okay, and also it is followed by vomiting. So again, there are attacks of spasmodic coughing, followed by a whoop sound. That's the long drone inspiration or inhalation, and usually it ends with vomiting. And it is common. I mean, it affects more children than any other age groups in the population. And the etiologies are Haemophilus pertussis or Bordetella pertussis, although most of the references are giving Bordetella pertussis the more common one. Okay, so we have an image here. So as you can see, it can, because of the pressure being produced when coughing. Okay, imagine that 5 to 10 successive forceful coughing, then ending with a long drawn inhalation followed with vomiting. It can produce cyanosis. Okay, that's not even blue. That's like it's black. Okay, and then the capillaries are ruptured because of high pressure. Okay, and bordetella pertussis is usually destroyed by light, by heat, by drying. The incubation period is usually 3 to 21 days in one reference. Then we also have 7 to 14 days and 7 to 21 days based from other references. Again, it's best to read more references. A period of communicability is 7 days after exposure to 3 weeks after the paroxysmal coughs. Okay, and may I just remind you, this is also only a additional resource, a sort of refresher. So again, I'm emphasizing that you still need to read references, books, listen to your teacher's lectures, take down notes. Okay, mode of transmission is usually direct through droplet, respiratory droplets, and usually the reservoir are humans, okay, or the source are humans. Okay, yeah, the manifestations of this disease is divided into 3 stages. The first stage is usually the most dangerous because it's highly contagious at this point because of the production of possible droplets from colds and cough at night, and fever and listlessness. Then cough becomes irritating and nocturnal. Okay, so it's more common at night, and this is just like what I've mentioned. This is the most dangerous stage because it's highly contagious. It's most communicable. Okay, and this usually lasts for 1 to 2 weeks. Okay, it lasts for 1 to 2 weeks. Then the second stage is the spasmodic or paroxysmal stage. This is characterized by 5 to 10 forceful successive coughing, which ends with a prolonged respiratory phase or the whoop, inspiratory breathing, producing a whoop sound. Okay, based on other references, there is an aura or a sign of an impending attack. Then cyanosis can happen, popping out of the eyeballs, destruction of the tiny blood vessels in that area. Then congestion of the neck and scalp veins because of high pressure also, and because of high pressure, uh, increase intracranial pressure can happen. Intracerebral bleeding can also occur, and this usually happens 7 to 14 day of the disease. And the calf has mucus also, so the um, the patient is prone for choking, for vomiting. Okay, the coughing increases the pressure, intracranial pressure, so the child is prone to increase intracranial pressure, meaning, the child is prone for nose bleeding, for periorbital edema, for hemorrhage, especially on the tiny vessels. The face becomes cyanotic, facial and neck veins are distended, popping eyes, protruding tongue can also happen, can be manifested, and convulsions can also occur. Okay, convalescent stage. If this is the stage where in the child, or in which the patient gets better. Okay, the road to recovery. So the cough is diminished in frequency and duration, and the child is considered to be returning to normal condition. So based on from this one, it can also infect infants, and this is a microscopic view, okay, of the bacteria. Other associated signs and symptoms, aside from what I've mentioned in those three stages, you have vomiting, congested face and tongue, especially the veins, uh, teary red eyes and protrusion of eyeballs, distended face and neck veins, involuntary defecation, so including the stomach or the GI tract as in general is um, affected by increased pressure. Maybe there's also increased abdominal pressure, and hemorrhages can happen in those tiny vessels in the ear, convulsions, abdominal hernia, or loose loss in Tagalog can also happen. Diagnosis is Bordet Gengu culture plate or the cuff plate test. In other references, nasal swabbing can also be done, uh, taking samples from the nasopharyngeal secretion. And usually WBC count or WBC, yes, count is increased up to 50,000 or more cubic millimeters. Then complications are otitis media or infection of middle ear, bronchopneumonia, TB reinfection, malnutrition, brain damage due to seizures, and brain damage can lead to epilepsy, to mental retardation. So it's based on the complications, it's really dangerous once you have this type of disease. The treatment of choice or the drug of choice is an antibiotic, aside from the uh, immunization, which is gamma globulin. Treatment of choice is erythromycin, or if not possible, penicillin. Erythromycin shortens the period of communicability based on researches. Ampicillin or penicillin is if the person is with allergy or erythromycin is not available. Um, Usually, hyperimmune pertussis gamma globulin is given to patients by injection, of course, intramuscularly. Then, in worst case scenarios or in severe forms, if the doctor can decide, sedatives are also given, okay, to control cough. Imagine if you have 5 to 10 or more successive, okay, successive cough. Okay, so that would be too irritating, discomforting, and dangerous. Nursing care, aside from the treatment, complete bed rest. This is to conserve energy and to some references would say prevent complications, prevent aspiration because of the choking episodes and vomiting episodes. Proper positioning when feeding, small holes of nipple for bottle feeding for infants. Feed with medicine dropper if possible or if it's necessary. And during the attack of cough, it is highly advisable that the patient will not take in anything by mouth. Then generally it's supportive care and complete bed rest. As you have said, conserve energy, prevent aspiration. It's the diet is still emphasized, although it should be bland diet, a high caloric diet. There are references with, saying that you should omit milk and milk products because this increases the mucus production and irritation. Then refeeding can be done after vomiting, and the milk should be in room temperature because changes in the temperature of milk can irritate the uh, passages. And preventive measures, DPT vaccine. This was introduced in other video lectures. Infants exposed without active immunization should receive hyperimmune pertussis gamma globulin. So from an active artificial immunity, we're going to the passive artificial immunity. Okay, we're going with the gamma globulins. Okay, and of course, proper disposal of nasopharyngeal secretions. Since this is highly infectious, it's communicable. You should also isolate the patient. So generally, it's a respiratory precaution. Okay, so that is um, pertussis or whooping cough. Okay, so thank you for watching this video lecture, and we're going to continue this playlist, this video lecture series. So God bless future nurse. Thank you.